discussions in this show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions. Securities offered through Cambridge Investment Research, Inc., a registered broker-dealer, member FINRA, SIPC. Fixed insurance is offered through various independent insurance companies. Cambridge does not offer tax or legal advice.
Welcome to the SA Update. I'm your host, Mike Schuster. Each episode, we dive into meaningful conversations and timely topics designed to empower our communities and clients. From financial insights to real-life confidence, we're here to help you stay informed, inspired, and ready for what's next. I want to jump into the hidden truths and secrets, okay? Of Medicare. Do you need prior authorization for Medicare?
Absolutely not when you're first enrolling into Medicare. Part B, if let's say, for example, you've had group insurance, you took out your Part A, and now you're going to retire, you're over the age of 65. When you come into Medicare Part B for the first time, we cannot ask any health questions at all. So that pre-existing notion is not an issue when you first enter into Medicare Part B. However, 6 months down the road, after you have been on Medicare Part B for 6 months or longer, then you would be subject to medical underwriting, and the company does not necessarily have to take you.
So let's talk about the Inflation Reduction Act for a minute. It did change some drug coverage. What was new with that?
Well, the new part was that old blasted donut hole that everybody was worried about. It's gone.
Okay,
Don't
good.
have to worry about that anymore. What they have done is they've set up a $2,000 annual max on prescription drugs. So if you're taking a pricey medication, once you exceed that $2,000 mark, all of your prescriptions become zero copay at the pharmacy. Now, the nice part about what Medicare did do is they ended up putting a Medicare payment option in it, so that if you are taking some pricey meds, they will allow you to stagger out your payment options over 12 months. So it will give you a more affordable monthly payment at the pharmacy if you so choose. Now for 2025, that number is going to be increased to $2,100. So the cap is going to be raised by $100 for next year.
Yeah. So one last thing on we talked about hidden truths and secrets, and we just talked about this a little bit because enrollment's critical. So let's go back into that for a minute, because I want to talk about that just from what unexpected costs could happen from it and not enrolling correctly. So let's talk about that too.
Okay, if you do not enroll in your Part A when you are first eligible, so that would be either 65 or terminating employment, there is a 10% penalty that is added on, and that penalty is added on for twice as many years as what the number of years that you had not enrolled in your Medicare. So it's for, if you didn't enroll for 2 years, for 4 years, you're going to pay that 10% increase in your Part A. The Part B, that has a 10% increase in your premium cost every 12 months. So if you don't enroll for 2 years, you'll have a 20% penalty. Now, that penalty follows you for life. It does not go away, unlike the Part A. And also the prescription drug plan has a penalty associated to that. That penalty is 1% per month for every month that you were eligible to have a prescription drug plan and didn't enroll. And it is based on the national annual premium of $36.
And I think this leads into something that you and I talk about a lot of times, and that is when you're getting ready to turn 65, would you say 6 months or 3 months prior, sit down and do a consultation with somebody? Would you agree with that?
Absolutely. I would like to see people look at even 64.
Yes.
Because there are some things that are some of those unhidden truths about Medicare, and we're probably leading up to it from your side on that financial and that IRMA.
Absolutely. And IRMA is, of course, the gap that when you start making more money, you pay more, correct? So talk about IRMA just a little bit.
IRMA stands for an increase Medicare monthly allowance amount, and it is based solely on your income. Now, this got rolled out when the Affordable Care Act came into fruition. And for many, many years, Medicare Premium Part B was the same for everybody. However, that has changed and it is income driven. Now, the sad part about the IRMA is the fact that they are basing it on 2 year ago tax returns. So your premium set for 2025, that is looking at your 2023 tax return. Now, they don't just use a line item to determine your IRMA. It's determined by what they call a MAGI,
Okay.
a modified adjusted gross income amount. So essentially, it's taking your line 11 off of your 1040 form, adding in line 2, which is any of that non-taxable income that
Right.
you may have in, which could be alimony payments, could be a settlement, could be your traditional IRA dispersal. There's a downsizing. I've had people that got an IRMA because they sold their house. Real estate market's hot, so they sold it high, ended up downsizing to a smaller place. Now they get slapped with an IRMA. So it's important. And I tell people constantly, please get a good financial planner and a good CPA in your background because it's
And
important.
absolutely, that's a great point, because a lot of times we can help you pre-plan for that. Or in this case too, say, hey, you're going to always be here, but let's try to manage you to this number and such. So good, all good points. I really want to talk about this subject because when you brought this to my attention, this is something that's near and dear to me, because I just don't think we need more government and more government interference on things. So there's something you brought to my attention called HR 3467 that's in the House of Representatives right now. And I think it's really important we talk about that today. So talk about that with us.
Mike, I stumbled upon this House of Representative Bill 3467 when I was doing some additional research. And the bill was sponsored by a Representative Schweikert out of Arizona. Believe it or not, he's a Republican and brought this to the House, which I thought was kind of weird. What it consists of is mandatory enrollment into an MA, a Medicare Alternative Plan, at the age of 65. You'll keep that plan for 3 years. So essentially, you don't have any time to opt out until you've exceeded 68. And then at 68, you can go back to the traditional Medicare. How they're determining this is they are basing it on, they're going to automatically enroll you with the lowest premium for that county.
Wow.
And that scares the bejeebers out of me, because the lowest premium doesn't guarantee that you're going to be able to see your doctor, use your hospital, or receive the medications that you're on. I believe it's going to negatively impact the rural hospitals, the physicians, skilled nursing facilities are going to get negatively impacted by this as well. And the sad part about it, this rollout is going to happen January 1st, 2028, unless we stand up and start doing something.
Yeah. So we're going to flash on the screen here for those people that live in Nebraska. Your representatives, because I agree with you, because this is exactly what socialized medicine starts to look like and starts to take away people's choices, and it's just terrible legislation from that matter. You go in the lowest cost provider, um, and regardless of political affiliation, we all want the best healthcare for everybody out there. And this does not provide that at all. So like you said, I'm glad you brought this to my attention and we can actually talk about it on the podcast here, because this is not a political affiliation statement. This is about what's best for seniors out there and for everybody out there for healthcare purposes, and our physicians. Yeah, our physicians and our primary care providers work very, very hard, and we want to provide choice to them.
Absolutely. And
So,
I just, it's near and dear to my heart because I have a son that's a doc. I have another son that's a dentist. And both of them struggle with these MA plans. They're captive on the prices, the denials, the delays, the lack of reimbursement is really struggling. So this is super important that we, from the ground swelling, let them know, let our representatives know that we do not want any part of it.
Absolutely. That's 100% correct. Well, Mary, I really want to thank you for your time and coming. You're such a great resource for people out there.
Thanks,
And
Mike.
if people have questions, please reach out. Again, this is Mike Schuster, and my guest today was Mary Santin. And thank you for watching our podcast.
Thank you.
Discussions in this show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions. Securities offered through Cambridge Investment Research, Inc., a registered broker-dealer, member FINRA SIPC. Fixed insurance is offered through various independent insurance companies. Cambridge does not offer tax or legal advice.